Margie here. It is so exciting to me that there is a program developed by the Bone Clinic of Australia called Onero, and it's the culmination of a decade of research and clinical application in osteoporosis. And what they've found is that there's safe and specific exercises that not only improve bone density, but create resilience by shaping bone architecture, improving overall muscle strength, and preventing falls. And today I'm so thrilled because our special guest is Dr. Claudia Tamas. And Dr. Claudia is a doctor of physical therapy, a certified strength and conditioning specialist, and the director of women's health at Natural Medicine and Rehabilitation, where she leads a team of clinicians that holistically serve women throughout all stages of life. And Dr. Claudia is the first clinician in the United States to be a licensed provider of the Onero Program. So I love our interview today. Dr. Claudia talks about how she has developed this very safe program and the results. And we even at the end have one of the participants talking about their experience with Onero. So I think the implications of this are so amazing because strength training is so empowering, and that we can do it in a safe and effective way is just a win-win. So lots of great information. Stay tuned. Welcome, Claudia. I am so happy to have you on the podcast. This is such an important topic, and I think so many people's lives can be changed by this that I'm really thrilled that you're joining me and you're going to enlighten us about this program and this type of strength training. So before we get started, though, what I'd love you to do, I always like to hear the backstory of how you even got interested in Onero and osteoporosis. So why don't you share with us a little bit about you and how you got to do the work that you do that now you're so passionate about?
Yes, of course. Good morning, and thank you so much for this opportunity. I am super excited to speak about Onero as the first-line therapy, I believe, for osteoporosis. So I know you've been doing this for over 20 years.
25, over 25 years, actually.
Okay.
Yeah.
So just like you, I believe that every single one of us is called in some way or another to alleviate suffering around us. And certainly then there's no shortage of such opportunities. For me, going back and now over 10 years ago, more than 10 years, I was a student doing clinical rotations in a skilled nursing facility. And I was called to the patient's bedside to perform an initial PT evaluation on a woman in her late 70s who had just returned from surgery. She had fallen in her home the day before and fractured her right hip. And I remember like yesterday walking down the hallway to that hospital room and just hearing her sobbing through the door. And I entered the room and my heart just sank. The bed looked like it was empty. She was so little and so frail. And needless to say, I couldn't perform my evaluation because she couldn't stop crying. And I just assumed that she was in a lot of pain. So I asked her if she wanted me to call for pain medication. And she stopped and she said, I am in a lot of pain, but that's not why I'm crying. I have a I have a daughter who's a single mom. She has 4 kids, and I was her only help. And, there are 1.5 million stories like this every year in the United States, and some are more tragic than this. And, there is something that starts combusting in us when we're in the presence of somebody else's suffering. And for me, that was the initial spark. And that's where my passion started.
It's so interesting because that's what happened to me in a sense when you hear these things and know they could be prevented and know there's so much that people can do to be empowered so that doesn't have to be their story. And I think that's part of, that's a big part of my message as well. There are things we can do, and when we do them, we actually become better than we were before. So it's sort of a win-win blessing in disguise. Okay, continue. So you decided that it broke your heart. Okay.
Yeah. So, in natural medicine, we always use strengthening every patient that meets us ends up having weights in their hands because we do believe that we need to strengthen to be strong to maintain independence. And I'll be talking about sarcopenia a little bit down the road, as we talk about the benefits of Onero. But the reality is that when we are looking at providing an intervention for any condition, we like to use scientific process. So in the scientific process, the first thing that we do is make observations. And what do we observe about osteoporosis? Well, the first thing that we observe is that if somebody goes into microgravity, for example, like the astronauts did, they lose bone very fast. And these were men, right, in their 40s, I believe, which start with a higher peak bone density to begin with, and they became osteoporotic. If we pull a tooth out, right, we're seeing the bone absorbing because there's no loading there. And then on the other end, if we're looking at athletes that execute high impact exercise, we see their bones so robust and so strong. So we can then come to the conclusion that loading is probably the most important and the main factor when we're looking at the reality of our bone health. Another question that we can ask is, now we're loading, but what kind of movements should we be loading to and through? And here it's very interesting because anthropologically, when we're looking at various cultures and historically, who gets osteoporosis, and is osteoporosis something new that we're seeing, or was this always part of the human experience? I grew up in a small community in Romania, and we were in a very geographically challenging region at the feet of this big volcanic mountain, a small community. Romania was communist back then, so we didn't really have any of the Western commodities. It was an agricultural farming community, and we had no transportation, so everything we had to transport was carried on our backs. And it was not uncommon for me in my late teens to be able to carry the equivalent of my weight on my back. Now, fast forwarding to today, my mom is in her mid-70s, and she's still involved to some extent in those activities. And for her, menopause came and went, and she never developed osteoporosis. And she's a small woman like me. She's 5 foot, and neither any of her friends in her generation. In 2017, Cambridge University, I don't know if you heard of this, there was an archaeological discovery, and they found this bone. It was a humerus bone of a female who lived 4000 BC. This is like 6,000 years ago. And they took this and they performed this first time in history. We see this. They ran bone scans on this humerus. And then they compared the scores with the humerus of this Olympic rower in her 20s. And guess what? Astonishingly, this 6,000-year-old bone had greater bone density than this athlete in her 20s. And these athletes, they train 2 times a day, and they'll row, over 125 kilometers a week. So, of course, the question is, what was this person doing while she was alive? What kind of activities, behaviors was she involved in? And not to my surprise, were the same activities that I was involved in this very community I grew up. So, I kind of felt that if we pay attention and we make these observations and we follow this evidence, we can come out very easily with a program that will mimic that. And that's exactly what Dr. Belinda Beck did in 2011. For the first time, we see somebody paying attention, and they looked at this data and these observations, and they put these very movements. What were these movements? Pushing, pulling, lifting, pressing overhead, squatting, right? These are activities part of these communities. And actually, the very activities that we in the Western civilization avoid or are told to avoid, right? So we're certainly bearing the burden of that avoidance. But for the first time in history, we're seeing some results in bone density with the LIFMOR trial. And that's because the researchers definitely paid attention. They loaded these women through these very movement patterns, which are multi-segmental movement patterns with weights that were not light, not moderate, but heavier weights.
Yeah, it's so interesting because it's true. We want to be safe, and that's very, very important. Nobody wants a fracture, but because of that, we've actually taken it a little too far, and we're missing an opportunity to
Mhm.
really improve our bone density through a safe program like Onero. But the safety is critical. So there's a
Mhm.
really fine balance. That's why it's so important that people, well, what I like when I interviewed Dr. Belinda Beck for the summit that's coming up, she explained how they only train physical therapists and exercise physiologists. So it's not as though in some places you can just get a certificate and teach this.
No.
You truly have to understand the safety and have to have the background so that you are going to be safe. So why don't you tell us a little bit about the preparation? Because I think
Mhm.
that's so important, what you do in your clinic, how you've taken it so that we can guarantee that people are going to be safe. Because I think that's the biggest thing. People are just too fearful. And I think what you've done is incredible. And so why don't you share a little bit how you ensured the safety of this?
Yes. So we spend sometimes about 4 weeks, sometimes even 6 weeks, depending what the baseline is for that patient. But they will first meet me, and we spend about an hour and a half performing a comprehensive exam, and we're looking at all the functional movement patterns, strength, flexibility, balance. And based on that data that I collect from the patient, will start that patient on a baseline and then build them up. And by building them up, what we do is we ensure it's actually heavy duty education and awareness that happens in those first weeks. Although they do have exercises and they are assigned exercises every day at home, but they involved postural alignment, understanding where our head has to be in space, where our spine, what neutral spine means, how to manipulate intra-abdominal pressure so that when we are loading through these movements, we are not only protecting the pelvic floor, the abdomen, and those organs, but we're actually strengthening these organs, the pelvic floor and the abdominals and the core through these activities. So they go through this process for a few weeks. And when we are sure that they understand these particular multi-segmental movements that they are going to be performing with weight, then we slowly and progressively start adding weight to those very movements. And then before you know it, they are super women. Right now we only have women, but we do welcome men too.
Yeah. So how long have you been doing this and what are the results that you've seen in your clinic? I know at the end, we're going to have someone who's actually involved in it. Pat's going to come
Yeah.
share her experience. But what have you seen since you're in the, it's one thing to take the class and to understand the research, but it's another thing to bring it into your clinic as a physical therapist and see what results you've been seeing. So why don't you share what's been happening since you started?
So, Margie, this is very exciting for me to talk about. Because we do see the results that are very consistent to what the study shows, and I love to share that. You usually will see results consistent with 10% of the spine in terms of bone density, and around 6 to 8% of the hip, and that's kind of happening consistently when we're seeing these DEXA scans back. So that's, in terms of benefits when we're looking at bone density.
I have a
Um,
question for that. How long what's the interval that you've been seeing? I mean, that's a huge amount. That's
Huge amount.
unbelievable. I
Yes.
mean, is it a year? Like, how long
Yes.
have you been seeing the change in the
We
DEXA?
are using, so the study actually had the participants in for 8 months. We are using a year, particularly for the reasons that I told you before. Then many times I'll use 6 weeks just to train and educate the patient so I can make sure they are super safe. So then I like to see them for a year at least in the clinic. But make no mistake, this is a lifetime. Um, this is a lifetime lifestyle that you want to have. And the women that finished that year, guess what? They don't want to leave. They are still with us. They love it. They love the community. They feel really safe there, and they say, "Can we stay?" And I had this conversation with Dr. Belinda Beck, and she said, yeah, sounds familiar. They don't want to leave. We do have some patients that drive from very far. Some come from 2 hours away, others an hour and a half, and they are still super, super committed. This is the most committed and compliant group of patients that I've ever had in my life and in practice. And it's just super motivating for me to keep working with them. But yes, that's what's happening. They stay on board. They love it. And of course, we all love to hear that the bone density has improved. For me, and I'm sure you probably can relate to this as well, the boots on the ground reality for us as clinicians is also really looking at how we can keep that patient independent forever. And to me, I feel like I have a bigger vision for my patient than they have for themselves. And I know why, because I was at the bedside, I see the end of, a process that, sometimes is tragic and could have been prevented. And my vision is so much greater than just improving bone density scores. And sarcopenia is one of my concerns when it comes to losing independence. And what
You want to just share what because not everybody may know what sarcopenia is. So why don't you tell us what that is and what can happen and how we can prevent that?
So sarcopenia is muscle loss, and we're seeing this actually early. We believe that osteoporosis is a largely invisible disease. However, in the clinical setting, we see these first signs through sarcopenia, or loss of muscle and profound weakness, sometimes in the patients in their 40s, and we start seeing these signs. And I don't need a bone density scan to tell me that patient's going to be in trouble in 10, 15 years. Because when I look at them and we're assessing them through these functional movements, they are not able to perform them because of weakness. I already know what's coming for that patient, and I want to stand in its way. And so to me, this reality is even much greater than the bone density score, because I also know that if I build the muscle and improve muscle strength, well, those muscles will be pulling on the bone, and that's how I improve bone density. So to me, that's my first goal. I need to get this patient to build muscle, to get strong, and to be able to perform these functional movements that are absolutely necessary to maintain independence for the rest of their lives.
I really think it's one of the most empowering things people can do, because when you're strong and someone says, oh, can I help you lift that? I got this. No, but it's very empowering, because it's not what people typically think. As you age, you get weaker and deteriorate. Doesn't have to be. And that's what's, I think, so wonderful about this and wonderful about the work you do. A couple of questions, though. For people listening, what's the minimum? So if someone goes, or in an Onero program, is there a maximum amount of people? Because they get the one-on-one first. But
yes.
Through the program, it's not one-on-one. It's a group that's supervised to be safe. So what are the what's the minimum amount of time if someone, we're doing an Onero program?
So I'll start with the maximum. We can only see 8 patients in a class.
Okay.
But as I mentioned before, every single patient in that class has their own baseline. So it's not a class like you would go and everyone does the same thing. They have their baseline, they have their assignment, and they go through that assignment based on their own findings, their own evaluation, their own strength, their own challenges. So all that is taken into account. So although you have a class of 8 participants, each one is on their own journey, and they are just working there together. Yes, so that's.
And then it's twice a week. Is that correct? How often do they come?
That was another thing. When I started this adventure with Onero, I would have said, based on what I thought, that you would need more frequency. And that's what Onero helped me as a clinician, because we always loaded women, even before Onero. That was always a priority for me from the moment I was in practice, that I always did this. What Onero gave me was the frequency and the loading. That is the bare minimum that you need to see changes, to evoke changes in bone growth. And that what was used in the Livermore's trial was 2 times a week, 1 hour. So it's mind-blowing, 2 hours a week, right? And you're seeing these incredible improvements. So as I mentioned, we're seeing bone density changes, and it's the stories are so fun when women come back with these DEXA scans and they're like, I just met with my endocrinologist and they said, there's no way you can build bone. You have to go on the medication. And then she goes and shows them the scan. And like, yeah, I did. I grew bone. So it's super fun. And then the stories of strength. I mean, it's so awesome. We're having such a good time. The one woman was sharing a story where her tire, she had a flat tire and she was with her husband and her husband couldn't pick up the tire. She picked up the tire and put it in.
Love
So it's
it.
like, oh my goodness, so many stories. Or like somebody's daughter was moving and she was like, while before she was never touching anything to lift or to carry, and now she's the main mover. And it's
And how
just
old is she? How old was this woman?
all the participants are 60s, late 60s, some 70s. Yeah. So
Yeah, that's what's
mhm.
so incredible. I know in the study they had,
And they all have
yeah,
osteoporosis.
yeah.
Yes. So it's really, really it's really fun. I want to bring up another benefit that doesn't come up as often, but it does come up for me as a clinician. We talked about postural changes, and that's a benefit that we're seeing in Onero, and that's particularly because we are loading the skeletal muscles. So we're seeing a great increase in back extensor strength. And these back extensors are the muscles that maintain us upright in an erect posture. And why is that important? When we're looking at evidence, there is a direct relationship between vital capacity and mortality. What is vital capacity? Is our ability to expand our lungs and take air in. So if our postural muscles are weak and we're collapsing anteriorly, right, into a slouch position, what happens to our lungs? They are not able to expand, and we're seeing decrease in vital capacity, and this is highly correlated with increase in morbidity. So this, when we're starting Onero, we actually have a computerized program where we're running a postural analysis, and we take a baseline and then we measure throughout to see how these women are doing, because that's one of my main goals too, right? To maintain their ability to increase their vital capacity. So these are just a few of the benefits that we're seeing. But for me as a clinician, that this is enough. This will be enough to save these patients, right? Because we're not just working with bones, we're working with people. And there's so many aspects of somebody's life, right? And somebody's physical body, more than just the bones. And that's what I'm interested in, the whole person.
I love that. Two things I want to comment on. When you and I spoke beforehand, when we first met, right after I interviewed Belinda, I found out who you were. I contacted you because I'm like, oh my gosh, I have to speak to her. But anyway, you said something that I thought was really important and really goes along with what I believe and what I've been spreading to the community, that if someone has a metabolic issue, and this is your nursing background, I mean, I think that's wonderful, your whole entire background, you're able to, it's not as though you just let that go. You want to share that piece, because with osteoporosis, it's not easy. It's not easy. And there are many components. And this is a huge, huge one that everybody in some capacity, not everybody can do Onero, but everybody can do some type of exercise that's going to, even if they're just doing balance, that's going to improve them. But I think, we can't forget the other pieces. And why don't you just share what you had told me, because I thought that was so important.
Yeah, so in that initial evaluation, we do discuss the blood work component, the metabolic component, because as we know, is super important. If you are going to build something, you're going to have to need materials to do so. And that's where the nutritional component comes in, and other underlying problems. They may prevent us from absorbing the nutrients that we need to build the bone. So if my patient's going to work super, super hard, because in Onero, we work super, super hard and make that commitment, I want to make sure from the start that we're not missing anything. And the metabolic component is the one component that we're having a conversation about. So many times the patient already works with a functional doctor and they had their blood work done, or they work with an endocrinologist. I just want to make sure from the start there's somebody, we do this in our clinic as well, but I want to make sure that somebody's taking care of the metabolic part. And we're having this conversation on nutrition and making sure that that part is taken care of, because this is symbiotic.
Hey, it's Margie. I am so excited to tell you that my next summit, More Natural Approaches to Osteoporosis and Bone Health 2.0, will be starting on January 15th, 2024. You will learn the latest on exercise, nutrition, supplements, root causes, and effective integrative treatments for osteoporosis from 60 fabulous experts. The best part is that there are exercise and cooking demonstrations so you can put these tools to work right away. So many lives were changed from this summit in the past. People went from overwhelmed to empowered. So it's free, and I hope you will join us. Just click the link in the show notes to register. I can't wait to see you there. Now, if you are listening to this podcast and the summit is over, there's still a link in the show notes that you can access the replay. Now back to the show. Yeah, that's the thing. I truly look at it. I've said this many times on the podcast, but I do look at osteoporosis as an opportunity to sort of look at your life, what areas you may not be addressing. And then when you do the exercises through Onero and this type of strength training program, as well as take care of all the other things, really miraculous things occur. And people look back and say, wow, that was really such a blessing. So the other thing I did want to mention that I think so incredible in the research in the Live More is that the thickness, the cortical thickness of the bone actually changed in the hip. I mean, that is unbelievable, because that's where we're worried about all types of fractures, but hip fractures is so, as you said, it's so horrible what happens. And, where 24% of people die within a year of the hip fracture from complications. So the fact that these exercises, besides improving bone density, they're actually changing the shape and the thickness is quite amazing.
Yeah, I really loved to see that. And it's amazing to remember that these cells in our bones are so alive and so ready to respond. And that's why we're seeing changes in the bone architecture. And many times, right, and we know this from life, that something doesn't have to be super big to be super strong. And that's exactly what's happening. And I don't think, many times when we're doing the DEXA scans, we don't have all the tools to see this. And this is so beautiful for me to witness as a clinician, to see these women walking in every day better, stronger, more confident. Everything changes. But we used to think for a long, long time that the bone was just a dead tissue. And now we're understanding that every single cell in this bone is ready to make a change and to respond to loading and to respond to exercise. And we just have to do it. We have to recognize it, and then we have to apply it. And sometimes, although osteoporosis can be complicated, it can also be simple.
And
if we take one step at a time.
That's the other thing, because so many people are like overwhelmed. Oh my gosh, I have to do this, but you don't. It didn't happen in one day. And, you don't have to, you address one step at a time. So you can, so for people though, okay, so you're in New Jersey. You want to tell us, so for people listening in New Jersey, tell us where your clinic is exactly.
Our main clinic is in Somerset. Right now, that's where our main program is. So we're in Somerset, right off 287, exit 12. And we have another clinic in Long Branch, and we will be bringing Onero Program there at the beginning of the next year, because we do have a great demand when our clinicians speak about this program. And patients from, down the shore, they're like, oh my goodness, it's 2 hours and it's 287, it's so much traffic. And we finally decided that it's time to bring it there, because there's a high demand, and we want to bring this to our community. And we already have over 1.5 years of experience here and data now to back up that, okay, we're on the right track with this. So let's bring it to the other clinic, and hopefully we can see more sites popping up as well around New
Yeah, because
Jersey.
it's interesting. In Australia, Belinda Beck, they have the bone clinic. So all over Australia, if you're interested, I mean, because there are people listening from all over the world to the podcast. So what about Europe? Do they have clinicians in Europe? Do you have any idea?
I haven't heard.
Yeah.
No, I don't.
So
I haven't heard.
Australia, the bone clinic, if you live in Australia, you just look at the bone clinic.
Yeah.
Belinda Beck's going to be on the summit happening starting January 15th. But the other thing is that there's a training program. So you could also tell if you live California, obviously you're not going to fly into New Jersey to do this program. But what is the best? So they could talk to their physical therapist about being trained and.
Yeah. So that's what we do, because we do get calls from different states. And of course, you have to be on site. You have to be present for the classes. So that's always my recommendation. I'll usually give them the brochure and say, take this brochure to a center, a PT place near you, because they will not license trainers. They need somebody with a background in pathology and a clinician. And bring it over and, see if anyone in that clinic will be willing to get licensed. So that's what we've been doing. We receive calls from Florida and upstate New York, and it's sad because we want them to come and do it, and we want them to have the opportunity to participate in the program. But I think that the more exposure we give this program, the more centers we're going to see popping up, so that women and men have the opportunity to utilize this program.
Yeah, it's just so wonderful. I'm so excited because I'm going to start it in January. And even though I do all sorts of exercises, I don't quite do this level. So I want to actually experience the program as it is, as it's been shown to be effective. So I will keep everyone updated on all of that. But you are doing something, because we talked, since I do so much online work, and, this is not a program you can do online. It's absolutely not, because we want to explain why you really can't do this online.
Yes. So the level of supervision is so high, and it's just so strict. And if you're, it's almost difficult to explain, but if you come and watch a class or you become part of the class, you immediately realize that this is not possible. Many times at the beginning, I'm with my hands on you the whole time. So how could I do that, right? Through the computer. I'm very hands-on. And many times we need tactile feedback for that patient to understand the movement, or I need to demonstrate it 1,000,000 times in 1,000,000 ways, because that's the only way they'll understand it. So it allows me the flexibility and the freedom to teach that patient the way that they can learn. And I love that. I was always a very hands-on clinician, and I love to teach patients to the way that they can learn. And many times it's almost all the time is different from a patient to another. So I need to mold myself to whatever that patient will understand and will be able to respond to.
And just another thing about PT, though, because physical therapist, which I'm a physical therapist, we don't get. You want to explain, because you're also a strength and conditioning. You've also had, you were also doing training and weightlifting prior to this. So it's not as though every physical therapist in their education is going to have this specific knowledge. Is that correct?
Yes. Unfortunately, and I went to PT school, and that was not something that we were taught. Sometimes even more unfortunately, we're told not to perform those movements. Because we all hurt the patient. And that's definitely that's a mentality that we need to rid of. Like I was bringing those examples before in those communities, we already know this is the reality that's put in front of us, that these communities that perform these movements, they don't get osteoporosis. So that's all I need. I need to know that that's the reality. And then I need to match my intervention to reality. And that's how we work. So we need to perform them, but many times in PT school we don't get the training, and sometimes there is no time, because we do focus on pathology and acute conditions, and you run out of time. So if anyone's interested, they just have to go and learn this on, the other various ways. But it's possible if you want to. If you really want to do something, you will get it done. And that was my path from the beginning. And I had this training even before I went to PT school. So um, the training there was just to add the pathology, the understanding of how we're managing these patients, because we do have to look at their risk stratification of fragility and see how we're going to progress them based on that. So there's a little bit of science that we need to work there, based on where that patient is.
I love that, because oftentimes people will take a study and they bring it to their trainer and they say, I want to do this. There's so much more involved. The other thing, though, because you and I were talking and I was like, is there anything you could teach online to the community to help them, even with any of the strength training they're doing or anything? And you said there was. So in January, we don't have the date yet, but by the time this comes out, we'll have a date. So I'm really excited because you are going to come to my class and share some things that everybody can do that are safe, that you can show online. So I will have that. You want to just mention what types of things that would be?
Yeah, so I'd love to. And I did look at a few of your classes that other therapists taught. And I was like, wow, these women are so educated. So I can just piggyback on that and pull in the component of the pelvic floor engagement while we're performing strength training and how we're protecting that area alongside with preserving posture neutral through very specific movements. And I think we'll pick a couple of movements that are more common that people perform. And I'll use a model and we'll learn together. And I think that will be very valuable for your community. And this is definitely something that we utilize in the pre-Onero phase to teach the participants the principles of neutral posture, functional movements.
Yeah, so we'll have that information in the show notes, and I'm so excited about that. And I'm really thrilled about what you're doing, because we know exercise can help, but it can really help. And this is, and I think Belinda's study and the Lift More and the results from that. And I think also what's so exciting, that's been many years now. How many years ago did they do the Lift More now?
So Lift More was 2011. And this was the original study, which then was translated into clinical practice. And this is Onero now. It's over a decade of data. And we're pulling our data into this study. So every clinic that does Onero pulls the data. So we're having, it's already a large amount of data that we're collecting. And it just blows my mind that what an amazing safety grade we have. That, when I first started, I can't believe that we haven't really seen any injuries. A couple of occasions, one occasion I had to send somebody to rehab a knee. And that's because they came in with their knee hurting and they returned and we're loading them. And somebody developed some back pain at the beginning, and then we modified some things, and now she's loading and she got this amazing DEXA score. So totally worth it, but nothing major, super, super safe. And that's what we're seeing from Australia as well. And we looked at other studies too that used lower loads, and you're probably familiar with some of them, and their injury rates are through the roof, like 50%, 30%. So it's very interesting that you can work heavier and then yet safer.
Yeah, I think the fact that I remember there was an article after Onero in Osteoporosis International where they were, just showed that people are not having fractures and it's safe. And I thought that was so exciting. And that, what else was interesting, the people that were in the control group, afterwards, they're like, I want this. So when they then started the Onero, they started reaping the same benefits because they wanted the increase in strength after the study was over too. You see the results and you're like, oh gosh, I was so gypped,
Yeah. And when you think about it, it's 2 hours a week that you are investing in. I can't stop repeating this. You realize it's 2 hours a week right? And it can save your life.
It's so true.
So that's it's so awesome. When we put these in the context of, we're not agriculture, not farming anymore. So what do you do with the people? They want to improve their scores. You have to create something in the context of today's America. And I love that I have this opportunity to do it.
Yeah, it's so interesting that you came from that background. I didn't know that
Yeah.
about you. I mean, I knew where you're from, but I didn't know that that was really, so that's really fascinating that you've
Yeah.
seen the people, your mom. I mean, you see
Yeah.
people who are thriving just because
Yeah.
of their lifestyle, which is very different than what we do here in the United States.
Mhm. Yeah, I
Yeah.
remember her. She's asking me, I'm telling her I'm involved with this program. And she's like, what is osteoporosis? I was like, exactly.
That is so
Nothing
funny.
that you need to know. But
Yeah.
yes.
Oh, so wait, before we end though, we have something really important that we're going to share with everybody. We are going to bring on, well, but is there anything else that you want to say before we actually bring on our special guest? Because we're going to have Pat, who's done the program. We thought it would be great to have someone who's actually gone through it, who's also a physical therapist, but who's gone through the program herself, share her experience. But before we do that, is there anything else you want to say?
I just want to thank you for this opportunity. And I'm super excited to see Onero becoming the first line in treatment of osteoporosis. It has the potential to be so. And hopefully in a year from now, we'll see more clinics and more women having access to this program.
Okay, so we're going to bring Pat on now. So here we go. Welcome, Pat. I am so happy that you are here. And as someone who's gone through or going through this program, to really share your experience. And it'll be so helpful for the listeners. So I'm
Great.
just going to turn it over to you. So why don't you tell us a little bit about your experience with the Onero
Okay.
program and where you started from and where you're at now?
I'm a physical therapy clinician, and for years I've done therapeutic level exercises within the clinic for patients. But before that, I owned a fitness franchise. So I've exercised for my whole life. And the type of exercises we do were very typical of most people: Pilates, yoga, free weights, but light free weights. Back in the day, we did step. And then recently, as a mature woman, I found out that I do have osteoporosis. And I've known and worked with Claudia for years, and she had become quite passionate about osteoporosis and how to help these people and to keep them independent as long as they possibly can for their lifespan. And she came upon the Onero program and just bought into it right away. She presented it to myself and another staff worker here, and we thought, gosh, this sounds great. We would like to participate. I've exercised my whole life. I've owned a fitness franchise, and the methods that we used were lighter weights, high repetitions, and the Onero method is heavier weights, lower repetitions to really weight the bones. And I was so impressed how quickly the body acclimates and can really accommodate to lifting these heavier weights very quickly. The program is so extraordinarily safe. Everyone is looked to have perfect body mechanics before they're even allowed to begin using heavier weights. But once you know the mechanics, you're off and running, and the body just acclimates and accommodates so quickly. And there's women, small, petite women, doing 100-pound squats. So it really is extraordinary. And we've had a great experience. There's quite a camaraderie between the women because they're there working for their health and for their independence, not so much to fit in the bikini, but really it is about health. And there's quite a camaraderie and a sharing of information with the women. And it's fantastic to be working with Claudia. There could not be a better person to do this program, bring this program to the United States and to New Jersey, because she's a doctor of physical therapy. She's a certified strength and conditioning specialist and an RN. So she's got the goods and really understands what's happening in the body physiologically and knows how to get people working safely through the program. So I've had a great experience. I enjoyed it so much. I've actually got a license to teach my own class. So we do. I take her class and teach my own.
And where do you live in New Jersey?
I'm in Central Jersey in North Plainfield.
Okay.
And our office is Central Jersey as well.
Oh,
Yeah.
this is so great. So what happened to you personally, though? Even though you're a physical therapist and you were doing exercises, and this is what I see so often, people are doing great things, but there's another level that they can even accelerate to, and people are scared. But what happened to you physically when
Yes.
what were the changes that you personally
Yeah.
noticed? Yeah.
Yes. Yes. People are scared. I wasn't. I had great faith and know how to do these, but my strength has improved. I have long-term chronic back issues, some significant issues, and I can actually do these exercises and feel better physically walking out of class. Quite often, I feel better leaving class than I do coming in.
Oh, that's so wonderful. This is just so exciting. And Claudia is going to, has told us all about the results that she's been getting. But this
Yes.
is great from someone with your background. And the other thing I think you want to just share about, it's not something you can just look in a book and, you can't look at the Lift More trial and see this exercise and say, oh, I'll just do them myself. Do you want to share about that a little bit?
No, absolutely not. You do not want to do this in a book. The primary goal here before anything is safety, and that's done through Claudia's supervision and mine for my own class. We want to make sure everyone is safe before they start getting into the Lift More and the Onero program. And there has been wonderful results in a short time with the women who have been participating in this program. It's really incredible.
Yeah.
Yeah.
So exciting. Is there anything, Claudia, you want to ask? You want Pat to share?
We actually celebrated last night somebody
Yeah.
who had a DEXA scan return who was very unlikely, as per her doctor, to improve her scores. And she gained 8% of the hip. And we just celebrating. It was absolutely incredible. And we keep seeing the scans coming back. And it's amazing.
That's what's so wonderful about this. This is based on actual science. It's based on studies. They've done the randomized controlled good studies, and now you're seeing the results here, which is just so wonderful. The other wonderful thing is I live in New Jersey. When I interviewed Belinda, and I said, is there anyone doing it in New Jersey? And she told me about Claudia, and Claudia is 20 minutes away from me. I was like, are you kidding? In the whole United States, the person that's doing this is 20 minutes.
It's
So I'm
meant to be.
so I'm going to get started with Claudia
Great.
as well.
Good.
I'm so
Good.
excited. Is there anything else that you want to ask Pat while she's here before we end?
I think she was pretty thorough. Thank you so much, Pat.
Yeah.
Thank
Thank you
you.
so much, Pat. And let us
Thank
know
you.
also, really appreciate you
Yeah.
coming and sharing your
Appreciate you as
experience.
well. Thanks.
Thank you. Thank you, Claudia, so much for bringing Pat. So we got to see and really hear from someone who's been through the program. And then I'll be doing that after I finish the program. But is there anything else you want to share before we end?
Well, there is something, I have this vision after Cambridge performed a study on the 6,000-year-old bone that, 6,000 years from now, when somebody finds a bone from somebody who performed the Onero program, they would also be astonished at the bone density of that humerus bone, just like they were for that person that lived in those agricultural times.
I love that. Well, thank you so much. I'm so excited, and I will keep everybody updated. And all the information about Claudia's class, it's just an hour class online that she'll be doing, will be in the show notes. So thank you so much for tuning in, everybody.
Thank you.
I hope you enjoyed my interview with Claudia as much as I did. And now you have a better understanding of how you can use high-impact progressive resistance training to improve your bone density, as well as really enhance the quality of your life. So the Onero program is now available right now in New Jersey. However, I really believe it's going to be spreading throughout the United States as it has in Australia. And the good news is now we have a date. Claudia is going to be coming to my class on January 4th, 2024. And if it's past this time, there'll be a replay that you can access. And so I'll have all the information in the show notes, but she's going to show, as she mentioned, things we can all do that can prepare us for different types of lifting, weight training, any kind of resistance exercises, some of the very basics that's safe to show online. So I'll have the information for that, as well as the information on Claudia's clinic and Belinda back in Australia for the Onero program. So if anyone's a physical therapist or exercise instructor and something you want to learn, the information's in the show notes as well. So thank you so much for tuning in. And as I said, Belinda is also coming to the summit. She'll be one of the speakers, and that starts on January 15th. So make sure not to miss that as well. So thank you so much for tuning in, and I look forward to seeing you on the next episode.